and welcome to the Simulation and Integrative Learning Institute at the College of Medicine here at the University of Illinois, Chicago. My name is Bob Kaiser, and I am the Associate Director here at the Center. And this video is to orientate you before your mannequin simulation experience. But first, we want to provide you with some simulation agreements so that everyone has a useful and valuable experience.
Something to think about is to make room for and find worth in all voices. Be respectful of time. Own this with us. Try it on. Say it out loud. Make the implicit explicit. Have unconditional positive regard. Practice humility. Say what we feel. Suspend disbelief. Less on point, more on purpose. And surface cultural assumptions.
We understand that simulation can seem intimidating, so we are committed to providing you with a safe learning environment. We ask everyone to hold judgments at the door to allow for a safe space so that everyone participating will be brave enough to make those bold decisions. Students, you may proceed to Simulation Bay. You'll make mistakes, and that's okay. The most important part of simulation is learning from those mistakes.
Everything we do in simulation is confidential. We do reuse these cases, so please refrain from sharing these cases with your peers. Sharing specifics with your peers may disrupt their ability to have a similar learning experience as you did.
Now let's take a closer look at what you can expect to find within the patient's room. During the patient experience, there will be an embedded participant played by a member of the sales staff in the room with you. This person is a part of the medical team and will be available to answer any questions and assist in the assessment and treatment.
We have a 42-year-old male who was just brought into the ER by his family. He has been complaining of chest pain. He also has a history of other...
The embedded participant will provide a patient report and can assist by putting the patient on the monitors, starting IVs, retrieving supplies, obtaining labs or imaging, and administering medications. The embedded participant will not break character until the end of the simulated encounter. We invite you to work as a team, interact with your patient, obtain an assessment, come up with a differential diagnosis, and treat your patient just like you would in a clinical setting.
Sir, can you tell us more about your chest pain? When did it start?
Your patient, the mannequin, is very realistic and has heart, lung, and bowel sounds. It also has palpable, carotid, radial, femoral, and pedal pulses. But the mannequin does have limitations to the physical signs that it can exhibit. The embedded participant will be able to provide you with supplemental information as long as the appropriate exam has been performed.
I'm hearing clear lung sounds. Nurse, what are his skin parameters?
He's cool and clammy, and his...
Treat this like a real clinical encounter. Feel free to bring things with you that you would normally have in clinical settings, such as stethoscopes or reference cards. Almost everything you can do in a clinical setting you can do here. For instance, you can administer medication, provide oxygen supplementation, order labs, perform an ultrasound, and conduct most physical assessments.
Oh my gosh, I can't.
Hi there. How do you know the patient?
I'm his sister, and I came as soon as I heard.
When you enter the patient's room, there may be family or friends at the bedside. They are there to support this scenario. Consider addressing them in a professional and courteous way.
During the patient experience, if you feel you need to consult for assistance, every room has a phone.
There's a list of numbers nearby. Dialing the highlighted number will get you in contact with someone. You can obtain a consultation with pharmacy, radiology, surgery, or even your attending physician. In the event of a cardiac arrest, the patient can receive full force compressions, be ventilated, intubated, and receive electrical shocks from the defibrillator. Be aware that we use a real defibrillator that delivers live energy.
Clear. Everybody clear.
Please exercise all necessary caution during its use. When in doubt, ask the embedded participant for assistance. When the simulated experience is over, you will hear "End scenario" over the PA system. This denotes the end of the patient encounter. From here, we invite everyone to participate in a post-encounter, confidential, large group debrief. The post-encounter debrief is a great opportunity for an open and honest private discussion. Join us in being receptive to one another as we share authentic reflections of our experiences.
Lastly, all equipment and medications used in the simulation labs are intended for simulation use only.
All of our medications are labeled to indicate that they are not for human or animal use. Any medication or equipment that makes it into the circulation outside the center poses a serious health risk to the public. It also poses a genuine liability for the center and its employees. To avoid this from happening, please make sure that you leave all simulated supplies in the simulation bay.
This concludes your mannequin simulation orientation. Thank you for watching.